What if I told you that the reason you feel tired, forgetful, or moody every day isn't just aging? It could be a silent condition stealing your sleep and your health, night after night. Imagine this. You wake up every morning feeling tired, even though you thought you slept the whole night. Your spouse complains about your loud snoring. Some nights, you wake up gasping for air. But here's the truth. These might not just be normal signs of aging. They could be the hidden symptoms of a serious condition called sleep apnea. And the scariest part? Most seniors completely ignore the warning signs. Today, we're going to uncover the symptoms of sleep apnea that often go unnoticed, how they affect overall health, and what you can do about it. So stay with me, because recognizing these symptoms could literally save a life. What is sleep apnea? Sleep apnea is not just about snoring. It's a sleep disorder where breathing repeatedly stops and starts during sleep. These pauses in breathing can last for seconds or even minutes. The body wakes up briefly to restore breathing, but you might not even remember waking up. This cycle can repeat dozens or even hundreds of times per night. The result? Your body is never truly resting. There are two main types. Obstructive sleep apnea, OSA. The airway becomes blocked, usually by the tongue, throat muscles, or soft tissues collapsing during sleep. Central sleep apnea. The brain fails to send proper signals to the muscles that control breathing. For seniors, OSA is far more common, but both can be dangerous. Why seniors are more at risk. Sleep apnea explained. When we think of aging, we often imagine wrinkles, gray hair, or slowing down a little. But what many don't realize is that aging also changes how we sleep, and, more importantly, how our bodies breathe during sleep. One of the most overlooked health challenges seniors face is sleep apnea, and understanding why seniors are more at risk can make the difference between ignoring a silent problem and taking steps that protect both health and quality of life. So let's dive deeper into why older adults, especially those over 60, are significantly more vulnerable to sleep apnea than younger people. Weaker throat muscles. Think about a balloon. When it's new, it holds air firmly. But after years of stretching, it loses elasticity, making it collapse more easily. The muscles in the throat are quite similar. As we age, our muscle tone naturally decreases, a process called sarcopenia. This includes not just the big muscles in our arms and legs, but also the smaller muscles that keep the airway open when we sleep. When you're young, those throat muscles stay firm, preventing the airway from collapsing. But in seniors, the throat muscles are weaker and softer, making it much easier for the airway to close temporarily during the night. Every time this happens, breathing stops, sometimes for just a few seconds, other times for up to a minute until the body forces itself awake to restore airflow. This constant cycle can repeat dozens or even hundreds of times per night, leaving seniors tired, drained, and at risk for serious complications, even if they don't realize it's happening. 2. Weight changes and neck structure. Many people assume only people with obesity get sleep apnea, but that's not entirely true. Seniors can develop sleep apnea even with only small changes in weight. Here's why. As the body ages, fat distribution changes. Even if a senior maintains roughly the same body weight as they had in middle age, fat is more likely to accumulate around the neck and upper airway area. This added thickness around the throat increases the pressure on the airway, making collapse much more likely. For example, a person might gain just 5 to 10 pounds, but if much of that fat settles around the neck, it can make a huge difference in airflow at night. This is one reason why seniors often notice new sleep disturbances after weight changes, even if the gain seems small or normal for aging. 3. Medical conditions linked to sleep apnea. Another major reason seniors are at greater risk is the presence of other chronic health conditions. Unfortunately, the chances of developing illnesses like high blood pressure, diabetes, and heart disease increase with age, and all of these conditions are closely tied to sleep apnea. Heart disease. Interrupted breathing at night puts immense strain on the heart. If a senior already has heart disease, sleep apnea makes the condition worse by reducing oxygen levels, raising nighttime blood pressure, and forcing the heart to work harder. Diabetes. Studies show a two-way connection. Sleep apnea increases insulin resistance, making it harder to control blood sugar. Meanwhile, diabetes-related nerve damage can affect breathing regulation, further worsening apnea. Hypertension, one of the strongest links. Sleep apnea is a recognized cause of resistant high blood pressure, which doesn't improve even with medication. For seniors, these conditions rarely exist in isolation. It's common for someone over 65 to have two or more of them, creating a perfect storm, where sleep apnea develops quietly in the background. 4. Medication use in older adults. Another overlooked factor is medication use. Seniors are far more likely to take multiple prescriptions, sometimes called polypharmacy, and many of these medications influence sleep and muscle tone. Sedatives and sleeping pills. While they may help a person fall asleep faster, they also relax throat muscles too much, allowing the airway to collapse. Pain medications, especially opioids. These can slow breathing and make apnea episodes more dangerous. Anti-anxiety drugs. Similar to sedatives, they can depress the nervous system and worsen airway obstruction. This creates a dilemma for many seniors. The very medications they rely on for comfort, sleep, or pain relief may actually make sleep apnea more severe. 5. Natural changes in breathing patterns. With aging comes a shift in how the brain regulates breathing. The brain's responsiveness to low oxygen or high carbon dioxide levels weakens. In simple terms, younger people wake up or adjust their breathing more quickly when oxygen levels drop, but seniors often don't respond as strongly. This means apnea episodes in older adults can last longer and reduce oxygen levels more severely. Over time, these oxygen drops damage blood vessels, strain the heart, and impair brain function, contributing to memory loss, morning headaches, and even higher risk of stroke. 6. Symptoms mistaken for just getting old. Perhaps the most concerning reason sleep apnea in seniors often goes unnoticed is that the symptoms are easily mistaken for normal signs of aging. Daytime fatigue? Many chalk it up to being old. Forgetfulness or brain fog? Often blamed on senior moments or early dementia. Morning headaches? Brushed aside as part of aging. Mood swings or irritability? Blamed on loneliness, stress, or age-related changes. But in reality, these can be red flags for sleep apnea. By normalizing them as just part of getting older, many seniors miss the chance for early diagnosis and treatment. 7. The hidden impact on seniors' lives. Sleep apnea doesn't just affect health. It affects quality of life. For seniors, untreated apnea can lead to reduced independence due to constant tiredness or higher risk of falls, worsening memory, making them think they're developing dementia, strain on relationships since partners often suffer sleepless nights from loud snoring, higher risk of serious medical events like heart attack and stroke. And yet, because the symptoms develop gradually, many seniors don't realize how much better they could feel with proper treatment. Part 3. Symptoms most seniors ignore. Let's break down the most ignored symptoms. 1. Loud and persistent snoring. Snoring may seem harmless, but when it's loud, disruptive, and regular, it's a major red flag. Many seniors laugh it off, saying, "Oh, I've always snored." But in sleep apnea, snoring is often followed by moments of silence when breathing stops. 2. Gasping or choking at night. Some seniors wake up suddenly, feeling like they're choking. They might blame it on acid reflux or a bad dream, but often it's a sign of airway blockage. 3. Morning headaches. That dull, pounding headache in the morning? It's caused by low oxygen levels and poor sleep quality. Many seniors treat it with painkillers without realizing it's connected to sleep apnea. 4. Excessive daytime sleepiness. Feeling tired all day despite 7 to 8 hours in bed is one of the clearest signs. Seniors often assume fatigue is just part of aging, but in reality, it's your body begging for quality sleep. 5. Difficulty concentrating and memory problems. Sleep apnea reduces oxygen supply to the brain. Over time, this affects focus, memory, and decision-making. Some seniors even confuse these issues with early dementia, when in fact, untreated sleep apnea may be the culprit. 6. Mood changes. Irritability, depression, or sudden mood swings often go unnoticed. Poor sleep disrupts emotional regulation, making small issues feel overwhelming. 7. Dry mouth or sore throat in the morning. Breathing through the mouth all night due to blocked airways can cause dryness and soreness. Many seniors ignore this as a minor inconvenience. 8. Nighttime bathroom visits, nocturia. Frequent urination at night is common in seniors, but it's also linked to untreated sleep apnea. The stress of interrupted breathing increases urine production. 9. High blood pressure that doesn't improve. If you're on medication but your blood pressure remains high, sleep apnea could be the hidden trigger. Interrupted breathing puts extra stress on the cardiovascular system. 10. Restless sleep. Seniors often toss and turn without knowing why. The body constantly shifts, trying to reopen the airway. Why ignoring sleep apnea symptoms is dangerous. Sleep apnea might seem harmless at first glance. After all, many people assume it's just loud snoring or occasional restless nights. But the truth is far more serious, especially for seniors. Ignoring sleep apnea isn't just about being tired during the day. It can quietly wreak havoc on the body and mind, sometimes with irreversible consequences. In this section, we'll explore why failing to recognize or treat sleep apnea is dangerous and how it can affect nearly every aspect of your health. Heart disease and stroke. The strain of oxygen drops. Every time sleep apnea causes a pause in breathing, oxygen levels in the blood drop. The body reacts immediately. The heart beats faster, blood pressure rises, and stress hormones flood the system. Over time, these repeated cycles create enormous strain on the cardiovascular system. Heart disease. Seniors with untreated sleep apnea are at a much higher risk for heart attacks. The repeated low oxygen episodes force the heart to work harder, increasing the chance of heart failure or arrhythmias. Stroke. Blood vessel walls are damaged over time due to fluctuating oxygen levels and high blood pressure. This makes strokes more likely, silent, sudden, and often devastating. Even if a senior feels fine during the day, the nighttime stress on the heart can silently chip away at their health. Sleep apnea doesn't knock on the door. It attacks when you're most vulnerable, in the deep hours of sleep. Type 2 diabetes. Sleep apnea disrupts blood sugar. Sleep isn't just rest for the mind, it's critical for regulating metabolism. In seniors, untreated sleep apnea disrupts the body's ability to manage blood sugar effectively. Insulin resistance. When oxygen levels repeatedly drop and sleep cycles are fragmented, the body becomes less sensitive to insulin, the hormone that controls blood sugar. Increased risk of type 2 diabetes. Seniors with sleep apnea are more likely to develop diabetes, or if they already have it, to struggle with blood sugar control. This isn't a minor inconvenience. Poorly controlled blood sugar can lead to neuropathy, vision problems, kidney disease, and a host of other complications. In essence, ignoring sleep apnea sets off a chain reaction that can make managing chronic conditions far more difficult. 3. Cognitive decline. Memory loss and dementia risk. Have you ever noticed a senior forgetting names, misplacing items, or seeming more confused than usual? Sometimes, sleep apnea is the silent culprit. When oxygen levels drop repeatedly at night, the brain doesn't get the rest it needs to function optimally. Deep sleep, especially the stage where memory consolidation and brain detoxification occur, is disrupted. Seniors with untreated sleep apnea are more prone to memory lapses, difficulty concentrating, and slower cognitive processing. Over time, studies show a clear link between chronic sleep apnea and increased risk of dementia, including Alzheimer's disease. Simply put, what feels like normal aging could actually be the early warning signs of sleep apnea slowly harming the brain. 4. Weakened immunity. Poor sleep reduces the body's defenses. Sleep is when the body heals, repairs, and strengthens its defenses against illness. Seniors with untreated sleep apnea are not getting this restorative sleep. Immune response drops. White blood cells and infection-fighting mechanisms are less effective. Higher susceptibility. Seniors may find themselves catching colds, flu, or infections more frequently and recovering more slowly. Inflammation rises. Chronic low-level inflammation can worsen arthritis, heart disease, and even cognitive decline. By ignoring sleep apnea, seniors may unknowingly undermine the very system that keeps them healthy, leaving their bodies vulnerable to both minor and serious illnesses. 5. Shortened lifespan, the ultimate risk. When sleep apnea is left untreated, the combined effects of heart disease, stroke, diabetes, cognitive decline, and weakened immunity accumulate. Over years, this silent assault can significantly reduce life expectancy. Studies consistently show that untreated moderate to severe sleep apnea increases the risk of early death from cardiovascular events and other complications. For seniors, this isn't just a theoretical risk, it's a real threat that can be mitigated with proper diagnosis and treatment. In other words, what might seem like just snoring or getting old could be quietly shortening life, making it critical for seniors and their families to take action early. How seniors can spot the warning signs. So, how can you tell if these symptoms are linked to sleep apnea? Ask your partner. They may notice pauses in breathing, choking, or loud snoring. Track your sleep. Keep a sleep diary. Note headaches, fatigue, or mood changes. Use technology. Smartwatches and sleep trackers can give early warnings. Look at your health. If you have high blood pressure, heart disease, or diabetes, take sleep apnea seriously. Part 6. What to do if you suspect sleep apnea. Talk to your doctor. Don't dismiss symptoms as normal aging. Ask specifically about sleep apnea. Get a sleep study. A test called polysomnography can confirm diagnosis. There are even at-home versions now. Treatment options. Lifestyle changes. Losing weight, avoiding alcohol and sedatives, and sleeping on your side can help. CPAP therapy. A continuous positive airway pressure machine keeps the airway open. Oral devices. Special mouthpieces reposition the jaw and tongue. Surgery in rare cases, for severe structural blockages. Part 7. Daily habits to support better sleep. Even if you don't have sleep apnea, cultivating healthy sleep habits is essential, especially as we age. Sleep is not just rest, it's the foundation for heart health, brain function, immunity, and overall energy. The good news is, small daily changes can make a big difference. 1. Maintain a regular sleep schedule. Our bodies thrive on routine. Going to bed and waking up at the same time every day, even on weekends, helps regulate your internal clock. This makes it easier to fall asleep at night and wake up feeling refreshed in the morning. Consistency is key. 2. Avoid heavy meals, caffeine, or alcohol before bed. Late-night meals can trigger indigestion, making sleep restless. Caffeine, found in coffee, tea, and even chocolate, can keep your brain alert when you want it to wind down. Alcohol may make you drowsy at first, but it disrupts deep sleep later in the night. Try to finish meals at least 2 to 3 hours before bedtime and limit stimulants. 3. Create a dark, cool, and quiet sleeping environment. The environment you sleep in matters. Keep your bedroom dark. Use blackout curtains if needed. Maintain a slightly cool temperature, around 65 to 70 degrees Fahrenheit, 18 to 21 degrees Celsius, which helps the body relax. Minimize noise, or consider white noise or soft music if external sounds are unavoidable. 4. Light exercise during the day. Physical activity is excellent for sleep, but timing is important. Gentle daytime exercise like walking, stretching, or yoga improves circulation, reduces stress, and encourages restful sleep. Avoid strenuous workouts right before bed, as they can leave your body energized instead of relaxed. 5. Use relaxation techniques. Finally, cultivate relaxation before bedtime. Meditation, deep breathing, or simple mindfulness exercises can calm the mind and prepare the body for restorative sleep. Even 10 to 15 minutes of slow breathing or guided relaxation can reduce tension, helping you drift off more easily. Part 8. The emotional side. Here's something many people forget. Untreated sleep apnea doesn't just harm the person, it affects the entire family. Partners lose sleep because of loud snoring. Seniors miss out on time with grandchildren because they're too tired. Quality of life declines, slowly but surely. Recognizing symptoms and seeking help is not just about extending life, it's about improving the quality of those years. Final thoughts. Sleep apnea is often called the silent killer because so many seniors ignore its symptoms until it's too late. But it doesn't have to be this way. By paying attention to loud snoring, fatigue, headaches, mood changes, or memory lapses, you can take the first step toward better health. Remember, sleep is not just rest, it's medicine for your body. If you or someone you love shows these symptoms, don't wait. Talk to a doctor and get tested. Because every breath matters, every night matters, and every morning of your life deserves to begin with energy, not exhaustion.